I'm Linda Kemby reporting for DIA, and we're here at the DIA 2013 49th Annual Meeting in Boston. This year the focus is on advancing therapeutic innovation and regulatory science. So let's go check out the companies making it happen. I'm here with John Poland of Convance, and John is head of ACRO's EU Scientific and Regulatory Committee. And John, if you could talk about some of your action agenda items in Europe.
Yeah, sure. There are two key legislative items going through the parliamentary process in Europe at the moment, which are key for us. One is a proposed regulation governing data privacy. The other, a proposed regulation that will replace the current clinical trials directive.
So what are some of the issues that you're focused on with your clinical trial legislation?
Well, first of all, we welcome very much the fact that there is this proposal to change the current clinical trials directive to a regulation which will be binding exactly as it is written on each of the member states in the European Union. So we will avoid the divergences that we've seen under the current directive. We're also very happy that the underlying philosophy of the proposed regulation allows for a risk-based approach to the management of clinical trials. The other three key areas that ACRO is focusing on within the proposals are the timelines for review of the application to the member states, the reporting of safety information, and some of the definitions within the draft regulation. In terms of the timelines, we're very pleased that the draft regulation proposes a maximum of 65 days, but we recognise that that is going to be very challenging for some of the member states to actually meet that. And so our concern is that during the negotiation process around the text, that these timelines will become extended, which we think would be detrimental to clinical research in Europe. As far as safety reporting is concerned, our position is very clear that we would like a simple statement within the regulation that reporting is required only to the central EudraVigilance database, so that we don't have to submit the same report to multiple bodies. And in terms of the definitions, there have been a number of issues under the current directive where the definitions have allowed for different interpretations by various member states. And we're not convinced that the definitions in the new regulation as it's proposed will get us away from that entirely. There are two specific examples would be around the definition of non-interventional trials, which we think is still open to interpretation. And there's a move to replace the current substantial amendment requirement with a requirement for substantial modifications. But again, we think the definition of a substantial modification could still be subject to variation. And what we would really like to see, the regulation proposes the establishment of an advisory group for clinical trials made up of the representatives of the member states. And we would really like to see a clear mandate in the legislation for that group to be responsible for removing these divergences so that we have a truly harmonised position and environment for clinical trials in the European Union.
What is ACRO's approach for engaging regulators in Europe?
Okay, well, we've had a number of meetings now over the years with the European Commission, members of the European Medicines Agency, and with the national regulatory authorities. And we are represented on a number of committees that some of the authorities have established to work with stakeholders and seek their views on forthcoming legislation and requirements.